The topic I will be discussing for my Pechakucha is euthanasia and its legality. Euthanasia is defined as the painless killing of a patient suffering from an incurable and painful disease or an irreversible coma. My focus is on assisted suicide and it being legal in all of the United States. The practice is currently illegal in most countries, and there are three types of euthanasia. Voluntary euthanasia, legal in some countries. Non-voluntary euthanasia. Patient's consent is unavailable. This is illegal in all countries. And involuntary euthanasia, without asking consent or against the patient's wishes. This is also illegal in all countries and considered murder. The practice of voluntary euthanasia is illegal in most of the United States. In the U.S., we have a similar practice known as physician aid in dying or assisted suicide. It is legal in the states of Washington, Oregon, California, Vermont, Hawaii, and Washington, D.C. Its legal status is disputed in Montana. I am going to be arguing why voluntary euthanasia should be legal in all of the states. The difference between euthanasia and assisted suicide is who is administering the lethal dose of medication. Euthanasia entails the physician or another third party administering the medication, whereas an assisted suicide is the patient's prerogative to self-administer the medication in order to end their life. As you can imagine, there are some reasons that people are opposed to assisted suicide. It has been said that it goes against the medical code of ethics. The current version of the American Medical Association's Code of Ethics clearly states that assisted suicide is prohibited because it is, quote, fundamentally incompatible with the physician's role as a healer, and it would be difficult or impossible to control and would pose serious societal risks. Another argument is called the slippery slope argument, which claims that once physicians-assisted suicide is legalized for the terminally ill, it will then leak into other communities such as the disabled and could begin to be abused by those who feel less worthy based on their demographic or socioeconomic status. Also, vulnerable populations may be subject to a more untimely death. The third reason people are opposed to assisted suicide is because of their religious beliefs. The Catholic Church has stated that one's concern for another's suffering is not a good enough reason to decide whether it is okay to act upon euthanasia. They also believe that it should be left up to fate and faith when one's life comes to an end, and purposely ending one's own life or assisting in ending another's in doing so is a sin. There are also many reasons people choose to support assisted suicide. The biggest being it ends the suffering of the individual who is choosing death. When death looks like to be coming for the patient within 6 months to a year, they can choose to have aid in dying as a medical option to shorten the unbearable process of dying. Those who are terminally ill in Oregon have said that they have chosen death with dignity because of the lack of ability to participate in activities on a daily basis, loss of autonomy, and loss of dignity. A U.S. poll shows that when a person has a disease that cannot be cured, do you think the doctor should be allowed to end a patient's life by some painless means if the patient and their family request it? Has been asked. In 1947, 37% supported assisted suicide, and the numbers have increased when the same question was asked again between 1990 and 2005, where 75% of people polled agreed. To safeguard vulnerable populations, rules and procedures would be placed in effect. Such as in Oregon and other states where assisted suicide is legal, 2 doctors and 2 witnesses must attest that a person's request for aid in dying medication wasn't coerced or under undue influence. Some other safeguards to this are proving your residency and eligibility. In some cases, you must meet with at least 2 doctors before you can proceed, and there is a psychiatric evaluation. Then the patient can make 2 oral requests within a 15-day waiting period between the requests, and then a written consent, which must be witnessed by 2 people, one which cannot be a family member, can be submitted. There are also some organizations here in the U.S. that support assisted suicide. One is called Compassion and Choices, which is a non-profit that was started to support end-of-life care. It was created over 30 years ago and also provides patients with legal assistance as well. Also, the Death with Dignity National Center was created in 1993, which is also a non-for-profit. There have also been family members in states where death with dignity is not legal that have said they wished that assisted suicide would have been an option because they watched their loved ones suffer for so long and they were helpless and they couldn't do anything to make it better. They just had to watch their life dwindle down till they died naturally. The Death with Dignity Act was passed in 1997. As of 2013, 1,173 people had had death with dignity prescriptions prescribed to them. Also, in 2013, there were 22 assisted deaths per every 10,000 total deaths in Oregon. The last state to enter the Death with Dignity Act was Colorado in 2016, totaling 6 states where it is currently legal. Personally, I support assisted suicide. I think it should be an option that is left up to the patient and the family to choose. If they are going to suffer for truly so long of a time, they should be given the right to end their suffering. I personally wouldn't want to be forced to suffer through a terminal illness, nor do I want to have to watch any of my loved ones do the same.